let's talk polio. Polio has actually got a really fascinating history, especially considering that, one of our very presidents is a survivor of it. In 1894, the first outbreak of polio pandemic began. That was before vaccines were a thing, and they didn't really have a name for this. It wasn't until 1905 that they discovered that polio has a very contagious situation, that it was extremely contagious. However, it took 3 more years to 1908 for them to give it a name, poliovirus. In 1910, Dr. Simon Flexner discovered that there was germicidal evidence in monkeys that had survived polio. That's kind of interesting. In 1916, polio hit New York City, and it was devastating. However, FDR, one of our former presidents, was diagnosed with polio in 1921. That was also devastating, but you know what? He's a survivor. He was a trooper. Keep in mind, all this time, people are thinking it's the lungs and the nervous system. In 1929, the iron lung was developed. All that time, people were just dying from it. They didn't have any other option. And it wasn't until 1931 that people were starting to realize that there were multiple forms of polio, multiple strains, meaning that it had mutated. In 1934, FDR celebrated his birthday as a huge, momentous milestone that he survived to that point with polio. In 1935, the first polio vaccination tests were being conducted. Now, these tests had very catastrophic results. They were not promising. In 1936, Drs. Peter Olitsky and Albert Sabin developed a new way to cultivate the poliovirus in embryonic brain cells. And in 1938, the March of Dimes was born. In 1941, a huge breakthrough happened. They discovered it in the stomach as well, or specifically in the digestive system. They, till this time, thought it was mostly just a neurological disease. In 1944, FDR pleaded for a victory over the polio epidemic. In 1948, Hilary Kloprowski drank a vial of his own vaccine after testing it on chimpanzees. His assistant also took it, and they suffered no ill effects. I'm going to need a part 2. History of Polio Part 2. In Boston in 1949, the team of John Enders, Thomas Weller, and Frederick Robbins showed that they could grow the poliovirus in non-nervous tissues, such as embryonic skin and muscles. This was a huge step towards reducing the amount of primates being used for this testing. Later that same year, doctors David Bodian and Isabel Morgan discovered that there were, in fact, 3 types of polio. This was done at Johns Hopkins University. Very prestigious. For Dr. Koprowski from earlier, well, in 1950, he went to a New York hospital for disabled children with epilepsy and whatnot, and tested his vaccine on them. He tested it on 20 children, all of which did not contract polio, but in fact gained an antibody. This was another huge breakthrough in the medical field. However, his methods were extremely controversial, so, they garnered a lot of dislike. In 1951, Dr. Jonas Salk and his team developed a method to cultivate the poliovirus in monkey kidney tissue. This method would lead to the ability to produce large quantities of the virus for vaccine use. In 1952, several researchers were testing if immunoglobulin, or IgG, could be used to protect individuals from polio. Short answer is yes and no. It was extremely expensive to produce, and it really only had a very short amount of shelf life for actual, protection. In 1952, polio cases soared with 57,628 new cases. On top of that, that's 21,000 more, which were paraplegic cases. This scared parents because kids seemed to be the most susceptible, and this warranted a lot of people begging for a vaccine. Sound familiar? Later that year, Salk and his team, with the support of the National Foundation for Infantile Paralysis, began their first tests on humans for their killed version of the polio vaccine. The subjects were resident children in institutions for the mentally and physically disabled. He tested 3 strains, some in combination and some on their own. I'm going to need a part 3. History of Polio Part 3. We left off in 1952 when Salk was testing the polio vaccine on child recipients in an assisted living facility. His studies showed that recipients of those vaccinations produced antibodies for that specific strain, which was huge breakthrough. And this produced evidence enough to warrant them to be able to move on to larger trial studies. By 1953, Salk had become a public figure because of his efforts, and he was well known in the medical community. And another thing that attributed to his fame was that he, in that same year, 1953, gave the vaccine to not only himself, but his wife and his 3 sons. In 1954, the Vaccine Advisory Committee approved a field test of Salk's polio vaccines, the trials starting on April 26th of that year. In all, 1.3 million children participated in that trial. It was a randomized, double-blind test. It would take almost a full year to analyze all of the results from this test and decide whether or not the vaccine had done its job. On April 12th, 1955, in a press conference at the University of Michigan, Dr. Thomas Francis Jr. announced results of the Salk polio vaccination trials the year before. According to them, the vaccine was 80 to 90% effective against paralytic polio. The United States government licensed the polio vaccine that same day. This paved the way for widespread distribution and use of that vaccine. April 24th, 1955, something known as the Cutter incident happened. Just a few short weeks after the licensing and the conference happened, an Idaho doctor found a case of paralytic polio in a girl who had been recently vaccinated. And over the next few weeks, results trickled in of the same sort. And the results of this were shocking. All cases, the vaccine arm where they got the shot at, the paralysis started there. Funny thing is, all the vaccines that caused this were produced from Cutter Laboratories in California. I'm going to need a part 4. History of Polio Part 4. Let's talk about the aftermath of that California Cutter Laboratories incident. A subcommittee of researchers and public health officials made several changes to the polio virus vaccine production methods in order to address the problems made evident by the Cutter disaster. They required manufacturers to test larger swatches of their vaccine lots. Now, by May 8th, 1955, then Attorney General Dr. Leonard Scheel suspended the polio vaccine program in order to investigate the safety of all 6 manufactured vaccines. The full review concluded that 11 people died from the vaccine and hundreds of people were paralyzed from it. Though there was no proof as to what caused this, a lot of evidence points to that the manufacturers did not follow Salk's instructional methods to the T, which of course resulted in it not successfully killing type 1 polio. In 1957, Kapowski, you remember him again, left his laboratories and went to the Congo, where he began starting trials. His vaccine only included type 1 polio, which of course was the type that was responsible for the most cases. Some of Kaprowski's findings were difficult to interpret, although at least one study confirmed the efficiency of the vaccine. Then the Belgian Congo entered a time frame of political and social unrest, which complicated the follow-up ability of vaccinated individuals. In 1959, Sabin formed a bond with Soviet officials who were interested in a cheaper alternative to Salk's vaccine. His OPV vaccine produced some promising things. The immune response was faster than Salk's original vaccine. It was oral, so it would go into the mouth and go through the digestion, which is how the original virus worked as well. He would feed it to them on sugar cubes. He would put the vaccine on a sugar cube and feed it to his case study patients to make it palatable. The IPV, however, maintained an advantage over the OPV. IPV had a killed virus, OPV had a living one. Otherwise, though, they were basically similar. In 1960, Merck researchers discovered a simian virus in the monkey kidney cells used to cultivate the vaccine before. SV4, as it would be dubbed, would cause tumors in hamsters. Isn't that exciting? I'm going to need a part 5. History of Polio part 5. Now, we left off with the discovery of tumors in hamsters. This prompted Merck to remove their polio vaccine from the market very quickly. By 1963, the government began to look for simian virus in the polio vaccines. In 1960, the link between viruses and cancer was a brand new idea. As a result, there was huge urging for the government to pull all IPV-style vaccines from the market for safety of everyone. To this day, polio vaccines are screened for known viruses. Hillman's research is why we no longer use kidneys of primates to cultivate vaccines. And this is really important. August 24th, 1960, Albert Sabin's polio vaccine was officially licensed, to be specific, by the U.S. It was highly effective against type 1 polio. Versions for type 2 and 3 would be soon forthcoming. A 1963 committee would then combine all three into one vaccine. By 1968, the IPV version of the polio vaccine would be completely phased out in the United States. This would be the case until 1997, when it would be phased back in again. In 1985, the Pan American Health Organization announced a campaign to achieve polio elimination in the Americas. Their goal was by 1990. This goal would not be met. However, the last case of wild-type paralytic polio was reported in the Americas in 1991. And the Americas were certified polio-free by 1994. In 1988, at its annual meeting, the World Health Assembly agreed to launch a global polio eradication initiative. Say that 3 times fast. At this time, polio was still an epidemic in 125 countries across the world. Their goal year was 2000, to eradicate polio completely. In 1997, an improved version of Salk's IPV vaccine was reinstated. This was because 8 to 10 cases per year since 1968 had been popping up of polio from the OPV vaccine. And this means that it was every 1 out of 2.4 million vaccines given gave someone polio. On a single day in January of 1997, health workers vaccinated 127 million children against polio in India. And this was huge because the country had been plagued. Coming up with another part for you. History of Polio, Part 6. We left off in 1997 when 127 million children in India were vaccinated in a single day in January. The next year, 137 million more children were also vaccinated in a single day. Now that's some heavy work. Although parts of the Sudan had severe political and economical and social unrest. In 1998, immunization days were established in both Sudan and Somalia to combat the epidemic. The World Health Organization considered vaccinations for these countries and countries like them vital. The CDC estimated that around this time, around 10 countries, including Afghanistan, Angola, Congo, Eritrea, Ethiopia, Liberia, Sierra Leone, Somalia, Sudan, and Tajikistan, were suffering greatly still. The UN was heavily advocating for days of peace in these countries during vaccination days so that everyone could get vaccinated. And surprisingly enough, even without formal ceasefires, that kind of worked. By 2000, there was a 99% reduction in polio cases, thanks to this vaccine, thanks to Salk's returned vaccine. By 2002, polio was completely eliminated in Europe. By 2003, the number of polio epidemic countries had dwindled drastically. On January 15th, 2004, the representatives of the 6 remaining polio epidemic countries, being Afghanistan, Egypt, India, Pakistan, Nigeria, signed the Geneva Declaration for the Eradication of Poliomyelitis, committing themselves to successfully implementing intensified polio immunization activities to stop the transmission of poliovirus by 2004. This goal would not be met. Polio continued to circulate in 4 of the 6 previously named countries throughout 2004 and 2005. However, Egypt and Nigeria would make it through the entire year of 2005 without a single new case. I'm going to stop there on my research, but I've been pulling a lot of this from the historyofvaccines.org as well as CDC websites. You can go ahead and continue research. This is an ongoing thing. So just remember, the vaccines are there to help. And people put a lot of effort and work into forming them to save us. Now you might ask me, why on earth did you just spend the better part of your morning researching and then spelling out the history of polio and its vaccination process? Well, that's simple. Polio was actually revolutionary for us. Its vaccine process evolved so much over the course of those decades that it revolutionized and paved the way for how we make vaccines now. It shortened the amount of time that is required to make a vaccine significantly. It paved the way. It was the grandfather. It started it. That is why when we got the COVID vaccine, it didn't take nearly as long. It did not take decades. It is because of vaccines like polio, like the polio vaccine, which we still get to this day. I got it. I know for a fact my kids got it. This one will get it. The vaccine, and that's fine because that will protect them. But it's thanks to that history that we can surmise how they managed to give us our vaccine so effectively and so quickly. Mind you, it still took a couple of years because, fun fact, COVID-19 has been around, but in animals. It jumped the species barrier last year, which in itself is terrifying. I mean, they were apparently expecting that to happen, just not quite when it did. But it was already in the FDA approval process, which means it was going through the case studies and the trials and stuff, which is very important to know. The FDA has worked very hard. The CDC has worked very hard. All these people have worked very hard to give us what we need to survive. And I spelled out the history of polio because I believe if we don't look at history, we can't understand our present. It's because I care. And also because I do find the history of polio extremely fascinating. And it is, if you think about how it started, how people were in the dark for years on what this was. Going from being in the dark on it to having an effective vaccine that eliminates the epidemic that is worldwide. To me, that's worth looking at. That's worth knowing about. I wish that they'd taught me that in school, but they didn't.